We have next Mrs. Mooney, which is a 58-year-old lady with a 35-pack smoking history, and she presented with a history of cough. A CT scan and PET-CT showed a lesion in the right upper lung, and we biopsied that, and it confirmed squamous cell carcinoma. There were no metastasis or nodal disease, and she underwent a lobectomy. And today we are discussing the histology and the management plan.
Sure. The surgical specimen showed a moderately differentiated squamous cell carcinoma confined to the right upper lobe. It measures 5 times 2 centimeters, completely excised. 3 intrapulmonary lymph nodes were excised, and 1 of them had malignant cells.
Right, so what should we do next?
This is a T2A tumor, as it is less than 4 centimeters in diameter. The nodal staging is N1, as the nodes are ipsilateral intrapulmonary. The overall staging for this patient is stage IIB, non-small cell lung cancer that has been surgically resected with negative margins. Hence, cisplatin-based adjuvant chemotherapy should be offered.
Thank you, Dr. Muhammad, for seeing me today on urgent basis. I'm sorry, I'm getting really stressed recently.
Yes, sure, no problem. How can I help you?
Thank you. You know that my sister recently died of lung cancer after fighting this disease for 1 year, and she was one of your patients.
Yes, my condolences.
Thank you. She was younger than me by 2 years only, and we both smoked for 40 years. I'm concerned that I may get lung cancer, and I'm asking you if there's anything that we can do to reduce the risk of getting lung cancer. I'm 60 years old and I don't want to die yet.
Low-dose CT scan is an effective lung cancer surveillance tool. In the National Lung Screening Trial, over 53,000 patients at high risk for lung cancers were randomized to either 3 annual screening with low-dose CT scan or single chest X-ray. This trial revealed that low-dose CT scan is more sensitive in detecting early-stage lung cancers. Furthermore, low-dose CT scan was superior in decreasing the number of advanced stage cancer diagnosed and increasing the number of early stage lung cancer diagnosed as well. In the Netherlands, the Nelson trial involving high-risk lung cancer patients also revealed that lung cancer mortality was significantly lower among those who underwent volume CT scan screening than among those who did not undergo screening. Moreover, the incidence of lung cancer was also higher in the screening group compared to the control group. Currently, low-dose CT scan screening for high-risk individuals is part of the NCCN guidelines.
Mr. Ahmed, thank you for coming today to the clinic. We're here today to talk about the screening program for lung cancer using a low-dose CT scan.
Yeah, thank you, doctor. I do appreciate your help, but I'm not sure really whether I should go for this program. You see, I stopped smoking more than 10 years ago, and I don't think I'm at risk of lung cancer.
Well, I think you have a valid point. Well, unfortunately, the risk is still there. You have smoked 10 cigarettes per day for 30 years, and you are 67-year-old.
Okay, well, I see. So what are the benefits from going through the screening program, doctor?
In the recent trial, high-risk persons defined as individuals 55 to 80 years of age with a smoking history of 30 or more pack years who currently smoke or quit smoking within the past 15 years underwent low-volume CT screening at baseline, then 1, 2 and 2.5 years intervals. This study showed that lung cancer mortality was significantly lower among those who underwent the volume CT screening than among those who did not undergo the screening. The incidence of lung cancer was also higher in the screening group compared to the control group. Currently, low-dose CT screening for high-risk individuals is part of the NCCN guidelines.
Let's start our MDT. This is the first patient. Mrs. Hala had a left upper lung lobectomy and it showed adenocarcinoma. Do we have the histopathology?
Yes, indeed. I have the report here. So this is a non-small cell lung cancer, adenocarcinoma subtype. The mass is 2.5 centimeters in diameter, completely excised. 10 lymph nodes are removed, none of which harbor cancer. No pleural involvement.
Well, her pre-surgery PET-CT did not show any distant metastasis. Does she require any adjuvant treatment?
This patient has stage 1A disease. There is no rule of adjuvant therapy for her. In a large pool data from the 5 largest trials, more than 4,500 patients of cisplatin-based chemotherapy in completely resected patients, there was no benefit of chemotherapy adjuvantly for stage 1A disease. There is about 5% improvement in the overall survival, benefiting of adjuvant chemotherapy to patients who have stages 2 to 3 non-small cell lung cancer.
We hope you liked our video. This is Acting for Clinical Education.
And don't forget to check the reference down below.
Please like, share and subscribe. And don't forget to join us every Thursday, 5 p.m. Greenwich time.